Okay, 5, 4, 3, 2. Hello, everyone, and thank you for joining us today for COVID-19 Facts and Myths. Our goal for this webinar is to give you the facts and most updated information about COVID-19. We know there are myths out there about the vaccines, but the science is very clear. The way to put COVID behind us is to get everyone vaccinated and boosted, to wear masks, to continue to be socially distanced in indoor settings, and to wash your hands. Testing is also important, especially if you will be with family and friends in indoor spaces. We're all tired. After almost 2 years of dealing with COVID, our frontline workers who care for patients and keep our facilities clean and safe are quite literally exhausted. But unfortunately, the battle we're fighting against COVID is not over, and we must stay vigilant, and we need your help. Our goal in bringing you today's webinar is to get the most updated, accurate, current information to you so you can be well informed about the disease and how to stay safe so you don't wind up in the hospital fighting for your life against COVID. We are fortunate to have 2 experts with us who will update us on the current state of COVID-19, the new variants, the effectiveness and safety of the vaccines, and why boosters are recommended. They will also discuss what else we can do to stay safe. We will hear about what's happening in our communities with low vaccination rates and why it's critically important to get everyone who is eligible vaccinated and boosted now. Our panelists today are infectious disease specialist, Dr. Ela Kole, and Master of Public Health, Trisha Zahn. Dr. Kole was born and raised in Mumbai, India. He completed his medical school at one of the nation's premier institutions, Seth GS Medical College and King Edward Memorial Hospital, prior to moving to the United States in 2013. He completed his residency in internal medicine at St. Vincent Hospital in Worcester, Massachusetts, where he stayed for an additional year as chief resident prior to graduating in 2017. Subsequently, he completed his fellowship in infectious disease and immunology at University of Massachusetts Memorial Medical Center in June of 2019. Given his love for the New England region, despite our winters, he joined Cheshire Medical Center, a member hospital of the Dartmouth-Hitchcock Health System in August of 2019 as the solo infectious diseases physician, and now serves as a consultant in the inpatient and outpatient settings as the infection disease prevention and antimicrobial stewardship programs. Dr. Kole has been an integral part of the Cheshire Medical Center and the DHH system efforts fight against COVID-19, and we really appreciate you being with us today.
Thank you so much for having me, Karen.
Thank you. Trisha Zahn is the Director of Community Strategic Partnerships for the Center for Population Health. A native of Wilton, New Hampshire, Trisha holds a master's degree in public health from the University of New Hampshire and a Bachelor of Science in Public Health from the University of Tampa. She worked for the Centers for Disease Control and Prevention in Maricopa County, Arizona until 2012, when she moved back to New Hampshire to start her position as the Public Health Emergency Preparedness Coordinator for the Greater Monadnock Public Health Network. In 2016, Trisha transitioned to Partner Manager for Cheshire Medical Center, where she was responsible for various community relationships and facilitating change with numerous partners. Through these relationships, the region's first community health improvement plan has been turned into an action plan. In 2020, Trisha advanced into the role of Director of Community Strategic Partnerships for the Center for Population Health, where she continues to support the center in designing and implementing improvement opportunities to advance the health and well-being of the region. Thank you for being with us today, Trisha.
Thank you, Karen. Happy to be here.
Great. All right, let's start with Dr. Kole. Dr. Kole, thank you again for being here, and we'd love an update on what you're seeing in our region now, why COVID rates are climbing, what is the status of the new Omicron variant in New Hampshire, and any other most current information you could provide, I think would be helpful to our audience.
Absolutely. We are seeing cases rising across the United States, and especially in the New England region, including in New Hampshire and Vermont. Our percent positivity rates are higher than what they've been in the earlier parts of this year and climbing. If you look at the data nationally, New Hampshire continues to lead the country with respect to daily average cases per 100,000 population. We are currently tied with Rhode Island, but we've been in this position for almost 2 weeks now, and something definitely that we did not expect and did not look forward to. As these cases are going up, New Hampshire and Vermont continue to see increasing hospitalizations. The numbers that we're seeing right now are way higher than our last surge, which we experienced in December 2020, Jan of 2021. Just to give you an example, we peaked at about 334 hospitalizations for the state of New Hampshire on Jan 1st of 2021. We beat that mark way long back. Currently, just as of yesterday, we were at about 475 hospitalizations and climbing. The concern we have is, even if some of this is attributed to the recent Thanksgiving holiday weekend and the surge subsequently, we're still in the second week of December. We are yet to see Christmas holidays. We are yet to see celebrations that may be associated with that. And there's a good expectation, if you look at the modeling data, that it's projected to only get worse, especially after these upcoming holidays, well into January. The troubling yet sobering fact that we're looking at is also the deaths associated with COVID-19. If you look at the United States, we recently crossed the mark of 800,000. Almost 3/4 of all of these deaths are dominated by individuals who were aged greater than 65. And if we spare a moment to just sort of think about this, this is way more than what we had first expected. This is way more than several other diseases that were expected to have high mortality rates. Even, for example, something like HIV, which was rampant in the 1980s and early 90s. If you look at what's driving all of this, I think there are several reasons. I think New England in itself is sort of stuck in this predicament where the weather's getting colder. That in itself promotes respiratory viruses because the weather's colder, people are moving indoors, celebrations are moving indoors. Compared to last year, our mitigation measures are at its lowest. People are not masking as much. Everyone's tired, healthcare workers included. So there's non-compliance on several different levels. We have a predominantly older population in New Hampshire and Vermont. So all of these individuals were probably vaccinated in the first phase when vaccines were first released, and not all of them may have been boosted. So we are seeing breakthrough infections. But I think what's probably more important is our suboptimal vaccination rates, especially in New Hampshire, and more so amidst younger population. The troubling fact is this is an age group which feels they are invincible and that they won't get afflicted by COVID-19 and that nothing would be wrong. The problem is that's not the story. We are seeing increased morbidity, increased deaths in younger individuals, and increased hospitalizations amidst younger individuals who are not vaccinated against COVID-19. We've seen deaths in age groups between 30 and 40, which is not supposed to happen for a vaccine preventable disease. The issue is also that younger population, even though they may not become as sick with COVID-19, are getting in touch with older individuals, say their grandparents, they're visiting nursing homes. And what happens is you may be an asymptomatic transmitter and putting the lives of your loved ones at risk. And I think it is high time that we realize the gravity of this situation, and without getting into arguments and polarized discussions about what works and what doesn't, it is high time we believe in data, we believe in evidence, and we believe in science. And I know we've all gotten tired of saying this, let's do the right thing. Let's do this now more than ever, but it's the reality. If we don't check our steps right now, we are going to be talking about this for several years to come. And I don't think anyone's looking forward to that. I will touch briefly upon the Omicron variant because that's increasingly becoming an issue in several countries, including the UK. The US, as of yesterday, the CDC is reporting about 3% of the cases in the US are probably related to Omicron. I will say that if you look at the HHS region 2, which includes New York and surrounding regions, the rates are even as high as 13%. What we know thus far is it is increasingly transmissible, probably more than Delta. The doubling rates of cases in UK are as low as 2 to 3 days. They're expected to see that becoming their dominant variant in another week or two. London's probably by this weekend, that's going to be the dominant variant there. We still don't have enough data to say whether it's going to lead to increased severity of illness, hospitalizations, or deaths. That I think time will tell. However, it is going to be an issue for us because we are still reeling under the effects of Delta. And now we're potentially looking at a surge, which would be Delta plus Omicron, and that does not bear good news. We know what works. We know vaccines work, but more than that, we know vaccines plus boosters work. So either you may have hybrid immunity where you've recovered from COVID-19, but you still need to get vaccinated because there are chances you're going to get reinfected with Omicron, even if you recovered from Delta previously. And if you've been vaccinated, to boost your antibody titers, you need to get that dose if you're eligible. How it's going to affect our therapeutics, how it may continue to affect our vaccinations, I think time will tell. But as we've been saying, without getting into the intricate details of how Omicron might affect us, I think it's really important that we stick to the basics and we stick to what we know works, something that you alluded to in the introduction.
Excellent. Scary to think that that's where we are after almost 2 years of dealing with COVID. You would have hoped that we would have made more progress, but we still have a long road ahead of us unless everybody looks at the data, looks at the science, and does the right thing.
Yeah.
So with that, let's move on now to Trisha Zahn, and I really appreciate you joining today, Trisha. I know that you have really a good view on what's going on in our communities, what you're seeing there, and from your perspective, why vaccination rates in some areas of our region are high, why it's low in others, and what do the low vaccination and booster rates mean for individuals and families in those communities where there are low rates? What are you seeing?
Thank you, Karen. With those prompts and what we've been seeing in the community, the anecdotal conversations we've been having with folks, I'm going to cover 4 themes today. So we're going to talk about prevention, we're going to talk about severity and risk, change fatigue, which Alok touched on, and some action steps, right? Where do we need to go from here? So when we think about prevention, we know that the available COVID-19 vaccines are safe, effective, and recommended. So when we talk about recommended, they're recommended by medical boards starting at obstetrics through pregnancy to pediatrics to teens, young adults, right through the entire lifespan. They're recommended by the religious community. The Pope and other religious leaders encourage folks to get vaccinated. This isn't political, this isn't governmental, this is medical, and this is public health. I've devoted my entire education and professional career to the health of the public, which is mainly focused in prevention. Prevention is hard. You can't always see it, you can't feel it, and it's often focused on long-term gains. So we know that vaccines are not 100%. They never have been, and that's okay. They don't need to be 100% to have an incredible impact. Vaccines reduce the risk of getting infected, of having symptoms, of transmitting to others. They reduce the possible length of illness and reduce long-term effects. You can picture infectious disease like glitter. So someone who's unvaccinated and symptomatic is spreading a lot of glitter to all those around them for over a week, right? That's why we have our 10-day isolation period for somebody who's infectious. Then we think of somebody who's vaccinated and contracts COVID-19. They'd be spreading a lot less glitter, those are infectious particles, over a shorter period of time. It's the end of 2021, and we have over 10 people dying in the state of New Hampshire every single day from a vaccine preventable illness. We all have a role to play to end COVID-19 and return to a familiar daily life. So we're looking for all of you to take action. Simple example of that is being able to wear a mask when in public. So you've all felt the moisture and the condensation inside your mask, right? That's a real-time example of masks working. All that moisture that I feel in my mask, is it doing its job to keep those potential infectious droplets to me? Again, right? Not 100%, but that's a heck of a lot better than 0%. So masks also stop you from touching your face, even if you do it mindlessly. How many of us go to the grocery store and lick our fingers so we can get those silly little plastic bags open to put our produce in, right? I didn't intentionally do it, but I just did it. Or I'm flipping through papers and I mindlessly lick my finger to flip through papers, right? Masks stop us from doing that. Being able to visualize it like layers of Swiss cheese. So masking, washing your hands or using hand sanitizer, physical distance, vaccines, boosters, right? They all play a role in helping prevent severity and spread of COVID-19. So using all those layers together is our best possible path forward, which leads me to severity and relative risk. So we think about everything being on a spectrum, right? Life is hard, it's complicated, it's complex. There is not one person in New Hampshire who's currently on a ventilator that thought this would happen to them, right? There's not one person in an inpatient bed in New Hampshire for days or weeks that thought this would happen to them. Those who need hospitalization and higher levels of care are overwhelmingly unvaccinated. Those folks did not take the preventive measure of getting vaccinated and need professional medical help to overcome a deadly infectious disease. Folks who don't choose prevention often like to repeat our state motto. We live in New Hampshire, live free or die, right? How many times have we all heard that? The problem with that logic is that the folks who cannot breathe will call 911 or show up in an emergency department. Folks who cannot breathe will reach out for help. It's a biological human nature. Once you need help, you will be looking for medical professionals from career and volunteer first responders to highly trained medical staff in the hospital to save your life. Folks who decide not to take preventive measures, such as COVID-19 vaccines, to stay on the free side of that equation will be looking for others' help to not end up on the die side of live, fear, die. We are inextricably connected, whether we like it or not, right? Third theme, we're exhausted, out of sight, out of mind. I completely understand that the pandemic is confusing and it's exhausting. You can look at restaurants, events, grocery stores, and just think, I don't get what all the fuss is about. This pandemic is happening inside hospitals, inside other private spaces like long-term care facilities. This is not a hurricane. It's not an earthquake. We don't have days and days of destruction footage. Our current public health emergency is happening in spaces we don't see every day. COVID-19 deaths of New Hampshire residents are reported as numbers every day. Those numbers are people. They're mothers, fathers, grandparents, daughters, sons, friends, coworkers, right? We're protecting people's privacy in the healthcare system and the long-term care facilities where people live, while also trying to convey and engage those outside the system that this is real and this is dire. All those who work in those facilities are exhausted. They experience the moral injury of being vaccinated and trying their best to save people's lives when more and more people come through the doors asking for help for those who have not yet helped themselves. So we all know that saying, right? Help me, help you. So help me in helping you by getting vaccinated, getting boosted, wearing a mask, not touching your face, washing your hands, staying physically distanced, and staying home while ill and getting tested, right? Minimizing those opportunities for close contacts. Change fatigue is hard. It is real. We have learned a lot over the past 2 years, and we're going to continue to learn more. Thinking about the relative impact, right? People will be like, I'm only one person. I don't go many places. You are important. You have a role to play. You are needed in this ongoing response to overcome COVID-19 and get back to what is familiar. Misinformation is like a crime. It needs to be monitored. It needs to be addressed. Misinformation is calculated, malicious, and intentional, and there's things we can do about that. So to be able to take action, right? Pray on it if that feels good to you. It's not too late to start a vaccine series. If you were eligible a year ago and you have yet to be vaccinated, we'd love to talk about that, right? Considerate of others. I'm vaccinated and I'm boosted. I do it for myself. I do it for my family. I do it for my community, the people I know and the people I don't know. I do it for my economy, for my future, right? Thinking about if you had 1 dose of Pfizer or Moderna months ago, let's get you your second dose. If you have 2 doses of Pfizer or Moderna months ago, let's get you boosted. If you're hesitant, if you still have questions, let's talk. If you don't have time, let's work on a workplace COVID-19 vaccination clinic. The vaccine side effects are minimal and they are nothing like COVID-19. And so thinking about what's in it for me, there's a much lower risk of being hospitalized or infecting others, and there's no quarantine required, right? These are all perks to being vaccinated and protecting yourself and others. So I appreciate the opportunity to address our communities today, and I'm happy to help Dr. Coley answer any questions. Thanks, Karen.
Thank you. That's great information and hopefully will resonate with everybody who still has questions, is concerned about the vaccines, and really is going to get the accurate information. And perhaps most importantly, understands the impact on everyone around them by not getting vaccinated, by not getting boosted, by not masking up. I think we have to really be mindful of all the tools and techniques that we have that we've learned about over the past 2 years and use them, implement them. So, what I want to do now is to kind of shift over to the questions that have come in that probably apply to both of you, and you can decide who will take the first shot at answering them. And if you both think that there's comments that you'd like to make, then we'll have both of you weigh in. So the first question is about traveling, especially right now. The question is it safe to travel right now with the increases in infections that we're seeing and with the Omicron variant now identified in New Hampshire? Well, let's have Dr. Coley take the first try at that one.
Sure. So I think there are different ways of looking at it. Obviously, I think the overarching message is, if it's non-essential, safest to avoid, right? However, we've said this in the past, and I'm going to continue saying this. We don't have to do everything like we did back in March of 2020. We know more about the virus. We have tools to protect ourselves way better than what we did back then. We are more than 18 months into this. So we have to find that middle ground in order to keep safe, yet sort of continue living life close to normal, close to pre-COVID times as much as possible. So if you had to travel, what are the safety measures you can take and to protect yourself? Masked when you're outdoors, masked when you're in public facilities like airports, on a flight, so on and so forth. What are you trying to go for? Avoid large gatherings. But if you're going for a family meeting, try and analyze the risk. Is it going to be a gathering of everyone vaccinated? Is it going to be a gathering of vaccinated plus unvaccinated, immunocompromised hosts, children who may not be eligible? That'll help you decide whether you want to try and have that gathering with everyone masked, whether you want to try and consider having a gathering of vaccinated individuals only, or whether you want to try and move the gathering outdoors if the weather permits. Getting vaccinated. We have enough data to show you may have a breakthrough infection, but the likelihood of symptoms being severe is very low. So you may get by with just a mild illness. We have data to say that even if you do get a breakthrough infection when you're vaccinated, the duration that you are able to shed infectious virus is lesser than someone who is unvaccinated. So that also reduces the chances of you infecting someone else. If you're eligible to get boosted, go ahead and get that. That boosts your neutralization antibody titers to a level where you're protected almost close to where you were when you were soon out from your second dose or your first dose if you got the Johnson & Johnson vaccine. We also know that in the setting of Omicron variant, boosting plus prior vaccination series brings back your levels close to where you were when we were trying to protect you against Delta, and which is fine. The aim is to protect you from severe disease, hospitalization, and death. And I think last but not the least, I would say that we have to utilize rapid testing measures. So CDC guidelines say it's recommended. Nothing's mandatory, but I think this is where the onus is on us to make the right decisions. Get yourself tested, and you can do this frequently. If you have the access to rapid antigen tests, yes, they may not be as perfect as the PCR tests, but you can do them more frequently. You can test 3 days before you're scheduled to travel. You can test the morning of your gathering, such that if you're positive, even if you're unsure of the result, you can isolate quickly and prevent yourself from spreading it to others. And all this in conjunction with your basic measures of hand hygiene, physical distancing, and staying away if you're symptomatic and getting tested promptly. All of these measures, no single measure is 100%. We hear these arguments about masks don't work. My glasses fog up, which means things are coming out from the sides and the top. We never said masks are 100%, but they're not zero either. And if everyone does their bit, and if you're able to even prevent 50 to 60% of the droplets or aerosolized particles getting out, you're making a big difference in community transmission. So bottom line, it's okay if you want to do it, but try and incorporate all these mitigation measures in place so that you can do what you need to do safely.
Excellent. Trisha, do you want to weigh in on that question?
I think Dr. Coley covered it very well. I think we know the importance of traditions, of being around people that we love and we care about. We know the importance of social connections. And I think everything he just articulated is great. We have ways to do that differently now and to do that in the most safe fashion, and ways that we can avoid any unnecessary or large gatherings, puts us all in a better spot.
Excellent. Well, I have a question here that came in that I think both of you will want to answer. I'm going to start with you, Trisha, and then we can throw it over to Dr. Coley. Question is, some of us have family members or close friends who are not vaccinated. Am I at risk if I spend time with them, even if I and my family are vaccinated and boosted?
Anybody who's unvaccinated is at a higher risk than those are vaccinated, right? So whether you spend time with them in those closed indoor spaces and large gatherings. And so there is a level of increased risk when we talk about the spectrum. And so making sure that folks sometimes have those really tough conversations, right? Do we understand why they're choosing not to? Is there new information we can provide? Are there things that we can help them feel more safe? We want folks to make the decision to be vaccinated and to use those other mitigation measures to protect themselves and their families. And so, yes, there is an increased risk whenever there's unvaccinated people gathering.
Dr. Coley?
Yeah, I would just add by saying that risk goes both ways. So there's a risk of the vaccinated individual potentially being an asymptomatic shedder that may lead to adverse outcomes for the unvaccinated individual, and vice versa, because we do know there is data to show that unvaccinated individuals have a 5 to 6 times higher risk of acquiring the virus compared to someone who's vaccinated. The viral loads may be high enough, they shed for longer durations as well. So even if you're vaccinated and you're gathering with other unvaccinated folks, there's also an increased chance of you potentially having a breakthrough infection. And so it is extremely crucial in these times when these questions come up. I will say, make it a point to refer to the CDC because they really have a nice segment on how to do this safely. Celebrating holidays safely, measures to take before you travel. And it's explained in very simple, lucid language because oftentimes we feel, the lingo that comes with medicos talking about it, and the lay public might say, I don't understand anything that's being said, so I'm not going to listen, and they tune out. But the CDC has made an attempt to sort of explain this in very simple language, no complicated medical jargon, so that folks who are reading it understand and take home the message that's intended.
Okay, thank you. And I do want to follow up because we've heard you mention a couple of times breakthrough infections. And I think it's important for people to really understand what is meant by a breakthrough infection and what does it mean if you have a breakthrough infection? Are you at risk for serious illness? Can you infect other people? Give us a little bit more on what a breakthrough infection is.
Sure. So I think I would preface that by saying, referencing something that Trisha mentioned, which is right. Vaccines were never meant to be 100%, and they're not. And we've always said that. Right? The aim for vaccines is not to eliminate the illness completely. The aim is to prevent severe disease, hospitalizations, deaths, such that you can continue living your life with potentially the virus circulating in the community without burdening your healthcare resources, allowing us to take care of individuals who may not have COVID, but other things that warrant care. Knowing that, so say a fully vaccinated individual, which is 14 days out from their second dose, so 14 days out from their first dose of the Johnson & Johnson vaccine, is out in the community, but for whatever reason is exposed to someone with COVID-19 and now comes down with symptoms. Infection in such fully vaccinated individuals is labeled as a breakthrough infection. It's semantics. It's the way you label that infection, but from an infection perspective, not much changes. You still are infected, so you have to isolate for the set duration. However, what data shows is the duration for which you may actually suffer from a lot of these symptoms, or the duration for which you're capable of shedding virus may be significantly lower compared to someone who is infected when unvaccinated. And that is also important to know that we know vaccinations have a significant efficacy rate with respect to preventing severe disease, essentially hospitalizations and/or death. So the likelihood of a breakthrough infection or an individual with breakthrough infection progressing to the point that they end up in a hospital, end up on a ventilator, or end up dying, those chances are really low. The only times we have seen that, and again, I want to say this, we have to be real about this and we have to be honest about it. At no point have we said that we've not seen that. We have, but those numbers are barely the ones that you can count on your fingers, right? It is seen in individuals who may be vaccinated, but have other immunocompromising conditions or may be on immunocompromising medications, limiting their ability to have generated an immune response to the vaccine to protect them from the illness. So it's not like we see that in everyone. So yes, there is a chance you may still get infected after vaccination, but your outcomes are bound to be way better compared to someone who's not.
Very helpful. I think there was a lot of confusion about just the term breakthrough infection. So excellent information. I'm going to segue over, since I know we have a limited amount of time at this point, and I just want to approach a question that I think is going to be helpful for folks who have struggled with how to communicate about vaccines and boosters with people in their families or friends who have made the decision not to be vaccinated. And the question is from someone who doesn't want to have a confrontation with those people, but are there other ways to help get accurate information out to them? Do you have some suggestions about how to get information to those folks from either family or friends that are trusted, or clinicians who are trusted individuals, to people who are adverse to vaccines or boosters and won't cause a rift? What tools, are there some techniques that can be used to really cut through those difficult conversations and help people have a productive conversation? Let's start with Tricia.
I think it's a challenging conversation, right? It's all dynamic. Relationships can be very different, whether you're talking to a family member or a friend, but being able to ask those open-ended questions from a point of no judgment. We want to better understand why someone is making this decision. And there's relative risk and a lot of other mitigation measures. So is this person going to a lot of bars and restaurants and in large gatherings, or do they see themselves as, you know, it's just me and I don't go very many places? So at what vantage point are they coming from, and how do we better understand that? And then being able to understand, is it a medical concern? Is it a religious concern? Is it a misinformation concern? Is it a side effect concern? I can't miss work. If I miss work, I might get let go. And so I'm afraid to get the vaccine because if I have side effects, it'll negatively impact my life, my economy, the ability to take care of my kids. Is that the reason? Let's have a conversation about side effects. So I think it's really about all those open-ended questions from a point of no judgment, being able to point them to trusted sources like Dr. Coley mentioned, right? The CDC has a lot of information to be able to articulate all the nuances that come along with this. And being able to ask those questions about what's in it for you. How can I help you see the benefit of this, of not having severe infection, of not ending up in a hospital, of being able to travel, of being able to go to certain concert venues, of being able to not quarantine, right? There's a lot of benefits to being vaccinated. And so how do we make sure that folks feel comfortable with those?
That's very helpful techniques, I think. And since we're a little short on time, I'm going to skip over to the next question to really talk about just so that people really understand the impact of the surge on our frontline healthcare workers. And I want to throw this one over to Dr. Collet because I know you really know what's happening right on the front lines, both at Cheshire and across our system. So why don't you fill us in on that?
It's a mixed bag of emotions, Karen. I think the baseline is just like the community, everyone is fatigued, right? We always think of healthcare workers as superheroes. They are in their own way, but I think it is time to ask a question of how long. We've been at this for close to 2 years. And for those who don't work in the setting, it is hard to explain, but I'm going to try my best. To take care of, for example, a COVID patient in the ICU, you have to don your PPE, which includes synthetic gowns, N95 mask, which is sitting so close to your mouth that at times, because you have to be protected against the virus, but wearing it for long durations can start causing skin damage, can start causing a very restricted ability to sort of converse with other staff members who may be in the room taking care of this patient. You have eye protection, you have face shields, you have rooms that are fitted with HEPA filters to keep the air pure, which are noisy. All of this coupled with already the equipment that used to be in an ICU room, such as ventilators, infusion pumps, monitors. So imagine the ruckus that's around you. You have to sort of silence all that out and then concentrate on taking care of a very sick patient who may have multiple care needs. And now multiply this by the number of times you may have to go in that room in a single shift, because these patients can have needs that fluctuate by the hour. And now multiply that by having 10 patients in the ICU, where usually the nurse to patient ratios, we've never seen a single ICU nurse having to take care of 3 or 4 ICU patients. We've never had to think of mobilizing ventilators in spaces where we were not used to or not supposed to run intensive care units. New York last year had to triage ventilators. They had to connect 2 patients to 1 ventilator. Things just keep getting challenging as this keeps on increasing. And now when you add all of that, it leads to burnout. It leads to grief, because as healthcare workers, you're not supposed to see your patients passing at a young age of something that could be prevented, right? We are used to seeing morbidity and mortality associated with illnesses. We are used to dealing with it, and we've done it in the past. But this is something where this could have been avoided. And just because the right choice wasn't made at the right time, that we're in this position. And this keeps happening on a recurring basis. So there's also the grief of losing someone who shouldn't have passed because of this illness. But there's also a tad bit of discontent and frustration. Because if we're doing our part to sort of help everyone through this, and we're relying on our communities and our social systems around us to try and help us do the right thing, to try and help us prevent these folks from getting in and suffering from this illness. But when we see that's not happening to the extent that's justified, we've had a lot of healthcare workers who were close to retirement, who were burnt out, and they decided to call it quits. Folks are leaving healthcare fields altogether and moving to other jobs just because they could not take it anymore. There's a lot of misconception out there that we're losing staff because of vaccine mandates, and that's not the case. We've lost less than 1% of individuals of our total workforce to those mandates because they decided to walk away rather than get vaccinated. And that may be individual opinion. But again, that's one of the examples of misinformation, is folks think we lost hundreds and 200 staff members. That's not true. We're losing staff more to burnout, fatigue, frustration related to COVID-19 rather than anything else. And that's something that none of us has seen in our career, and it's a very disturbing sight.
It is. And I think we're all seeing the impact on our staff, and we are also seeing the impact on people who do not have COVID and are trying to, or may have a need to access care in any of our facilities, but because of the surge may not have the opportunity, or may wind up in an emergency room for a lot longer because they cannot access the care that they need. So with that, and we're short on time, but I do want to wrap this up with asking each of you to leave the viewers with one takeaway that you think is really important for them to know, to really have something to think about as we wrap up this webinar, which I think has been excellent and really helpful, full of helpful information. So let's start with Tricia. What is the one takeaway you want people to remember from this webinar?
As a public health emergency professional, we're not dealing with a hurricane. We're not dealing with a earthquake that we didn't know was coming and that is completely out of our control, right? We're not there. We're in a pandemic of an infectious disease of which we know a lot about, and we have a lot of tools to combat. And so I think it's important for folks to take that time and reflect on what they can do if they're interested in getting back to what's familiar, if they're interested in protecting our economy, if they're interested in protecting our healthcare workers, right? Each and every one of us has a role to play to get back to that normal, familiar thing people are looking for, that they feel safe with. And so I think it's time to look at what you're doing in your sphere of influence that could have an impact, and that each and every person is important and has a part to play. So being able to think about, nah, it's them over there, they'll figure it out. It's every single one of us has a role and has actions we can take. And I just encourage folks to take the actions that are available to them and encourage those in their sphere of influence to do the same thing.
Thank you. Dr. Coley?
I will just say that we are all respectful of free will, autonomy, and the freedom to make your own choices. But I think it is time we realize this is a public health issue. Let's not politicize it. Let's not stand at two ends of a spectrum and make this about what I feel is right and what you feel is right. And I'm going to do what I think is right, and you can do what you think is right. It's more than that. Let's deal with this as a medical issue. Let's trust the experts who have studied for this very reason, that are trying to help us get out of this. If I was to have an issue with my car or with the electronics in my house, yes, I can try and watch YouTube and try and fix it, right? But the outcomes may not be the best. We go to trusted professionals. So why is it that with public health, we try to take matters into our own hands and decide what's best for us? We have to think about ourselves, yes, but we also have to go beyond us, think about our friends, family, and our community. And it's only when each one of us does what's needed is when we're going to see a post-COVID-19 phase where we're back to some semblance of normalcy, because no one wants to live in this perpetually. But we're going to be in that situation if we continue to argue and continue to reject what may be appropriate. It's not going to get us where we need to be. And it's high time we realize that.
Thank you very much. And thank you both so much for sharing most updated factual information, tips for staying safe as we weather the latest COVID-19 surge and the challenges that come dealing with it safely. And I want to thank our viewers for joining us today. We hope the webinar was helpful and it gave you the most updated safety information and tips, the most updated data. And we want you all to stay safe and share this information with others. We really do want you to have a safe and healthy and happy holiday season, and we want you to take care of each other and yourselves. And please do the right thing for yourself and your family members this holiday season. And thanks again for joining us today.
Thank you.
Thanks, Karen.